Hello, Tambi.
Hi, Sylvester. How are you?
I'm good. How are you doing also?
I'm okay. I'm okay.
Okay. The speakers are joining soon.
Yes, I did indicate to them that they need to be in 15 minutes before.
Oh, that's the big man.
It's fine. I'm hoping my cousin will come soon. Otherwise, I'll have a challenge. Yeah, but now he's doing good.
Oh.
Hi, Kwame. Hi, Sylvester. I'm seeing Kwame. Hi, Tembi.
Hi, Sheila.
Hi, Sheila.
Tembi, have you adjusted your audio settings?
Is it too loud? Let me get to it. Thank you, Sheila.
Hi, guys in the background.
I'm telling you, today.
I know it's been a hectic day for you.
Okay.
Sylvester, I've tried with the social media post. I just picked from almost every slide and yeah, see how that goes. But yeah, I've just compiled the tweets.
Okay.
How's the sound?
I think it's fine. Sylvester, what do you think?
Yes, it's good. It's good from my end.
Okay, thanks.
Sylvester, you make me calls.
Pardon?
Tembi, did you share the slide with the AU logo, the PowerPoint?
I did. Did you not get
Oh, let me see. People are joining. Okay, yeah, I have it.
Okay.
Thank
Sylvester,
you.
do you have the presentation?
Yes, Sheila shared with me some hours
I
ago.
have to send you this updated one, Sylvester, with the AU logo attachment. I've just forwarded now because I don't think you're copied. I've forwarded.
Okay. Thanks.
That's the one with the AU logo.
Okay, Stephanie is here.
Okay. I think she's trying to connect to her audio.
Hi, Stephanie. How are you?
I'm good. How are you doing?
Good, good. Sorry it took you a while to get the audio connected.
No worries.
Yeah.
Hold on, I'm just my I have an air purifier out. So hold on, let me turn my video on so you can see me.
Okay. All right. Okay.
You see
Hi.
me okay? Hi,
Yes.
how are you?
Good. I've just got a visitor here, but
Okay.
hoping he'll be picked soon.
Yeah.
So I'm Tembi. I think you saw me on the email, but wanted to put the face to the name. Thank you
Good
so
to meet
much
you.
for agreeing to join us.
No worries. No worries.
Yeah.
Wandy is such a busy lady, so I'm always happy to support her when I can.
Thank you. Thank you. I've got my colleagues on the line, Sylvester and Sheila.
Hi, Sylvester. Hi,
Sylvester
Sheila.
is
Hi, Stephanie. Thank you for joining us today.
Thank you.
Yeah. So Sylvester is the one who's going to be sort of supporting tech-wise. If you have any challenges whatsoever, please just drop him a message in the chat, and maybe he can assist. But we really hope that this is going to be an informal chat, and we are going to learn quite a bit from you and everyone else who's going to be
Sure.
participating in this panel.
Absolutely. And hi, Wanda. I think we've had a chance to meet before, but I'm blanking on where it would have been.
You're probably on one of the many panel meetings, but I'll have again.
Sure.
I
Absolutely.
also can't remember where I see people, if it's on screen or in person.
Hello, my family.
How was your graduation of your son?
Oh, wonderful, wonderful. I'm a proud mother. Thank you so much, colleagues, for giving up your time for this. It's my third meeting, can you believe it? And I'm operating out of North America. So you just have to look happy and be up at 3 a.m.
Oh, no.
Thank you. Hello, Wezi.
Hi, it's Tembile, and hello, everyone.
Good to see you. Good for joining us. Thank you. So I think maybe just as a briefing, Prof. Makota, welcome.
Welcome, everyone.
Good to have you. We are going to be starting at exactly 3 o'clock South African time, and we push until just about 25 past 4. We don't try to have the whole 1 hour, 30 minutes. So we want you to be free to relax. We do have some guiding questions, which I shared. I hope you've seen the run offshore. But feel free to expand and share based on your experiences, and as you sort of are feeling how the conversation is flowing. If there's anything you want to bring in, please feel free. We are going to be taking questions from the audience in the chat. For the first sort of hour of the webinar, we are not going to have that session interrupted. So we'll only take questions at the very end after the last panelist has spoken, then we'll take questions. We are also hoping that you will have some time to look at the thematic brief and provide us with your comments even after the webinar. If you can just take a few minutes of your time to look at that and share it with us. Prof. Svanda is going to be facilitating the first half of the webinar. I will then take over after the intervention by Prof. Makota. And then I will also be fielding the questions from the participants in the chat. Yeah. So I think in terms of lighting, in terms of sound, everyone was sounding good and looking good.
Thanks, Tembi.
Yeah. Okay, I see.
And I guess a quick one for you, because I know you're going to allow us some time to talk about interventions. So it sounds like you want everything to be more conversational. I do have a couple things I could throw up on the screen, but if you want to keep it without that, I'm happy to as well. I just want to make sure that it's the most impactful for the participants. So just let me know what makes the most sense.
Okay, if you have a slide or two, I think we don't have a problem. Prof. Spandit, you want to come in since you're facilitating that session?
No. I think let's line up the slides so that the transition does not change. So my engagement is going to be just with the two speakers at the beginning, Stephanie and Linde, and then we will go to the presentation, which is summarizing the thematic brief. And then I will hand over to Vanda to just give a critique, reflections, positioning, what's happening in the world, what have we got in the thematic brief, what is unique for Africa to position on, and just breathe life into it. And then I'll hand over to you, Tembi. Correct?
Yes, that's correct.
Yep.
Okay, but maybe on Stephanie's request to have a slide to emphasize the points, that is most welcome. Sylvester will help with giving you screen sharing rights.
Okay.
Yeah, comfortable
Okay.
with, yeah.
All right. Yeah. Let me, I mean, I've got so many slide decks. Let me actually just pull.
I think share the slide now, just in case there's a heat glitch.
Yeah.
Then our support can still, but you will be given rights so that you can do pointers. But let's have the slide.
And again, if we don't get it up in time, don't stress about it. I was just trying to think about, because at least the points I'm going to mention mainly are around like event-based surveillance and coordinated surveillance and kind of how that is going to really help and improve public health. And so sometimes it's helpful to look at a few of those slides. But,
it's a complex matter we are dealing with. So
it is, right? One health requires visuals, I think.
Yeah, so I think I'll definitely, start your end in terms of what does it mean? Can you take us to the world of One Health? How do you absorb it all? And how would you explain to a 7-year-old what One Health is all about? That's
Sure.
Yeah.
Sure, I like it. I like leading me. That's wonderful.
Linde, is Linde, yeah.
Yes, welcome. Thank you for joining
Linde,
us.
I'll go to your animal science. Maybe also it's a good opportunity to help the audience understand what do vets do that the animal scientists don't do? What do animal science mean in the context of animal health? What's your beef and steak in this process?
Okay, Prof.
Thank
We'll
you.
have a look at it, yeah.
Yep. So it's just a light touch to make sure we have a broad audience. So we want everyone to be comfortable. It's just 1.5 hours, but it's us to sort of paint the map and then look at the thematic brief that we have so that we gap fill appropriately and make it African. I think that's what these whole things are about. Yeah.
Okay.
What is
I'll try my
unique
best.
about Africa in all this?
No, I'll try my best.
Yeah. Good. I think we've got all speakers on board.
I'm following up with the farmer from Malawi, Hashim.
Yeah.
He's
So
just
in case he has connection problems, we still have this panel to fall back on in terms of questions.
Yep. Okay.
Stephanie, please pronounce your name the way your mother would pronounce it, all of it.
That would mean that I would include my middle name, but so I've got a lot of names. You can keep it simple and just say Stephanie Salyer.
Okay. It's
If
the
you
salvia.
want the
It's
whole thing I
salvia.
can give you, but salure is perfectly fine.
Salvia. Thank you.
You're welcome.
Five more minutes.
Do you guys want me to try to project my slides just to make
Yes,
sure?
please try. We've got 2 minutes before we all behave.
Okay. All right. Okay. So basically, it's just like 1 or 2 slides with like these kind of depictions, right?
Yep.
Okay. All right. Let me go ahead and stop.
Correct. And you will have it in presentation mode.
Yes. Yeah, yeah.
Excellent. Yeah.
Okay.
Prof, since we don't have any more discussions among the
You can
team,
let people in. You can let people in.
thank you.
I knew that's where you were going. We need to mute. Greetings to everybody who's joined us. We are live on Facebook. Welcome to Future Africa Institute at the University of Pretoria, where we are in a conversation that is dealing with the big, wicked problem that we are facing, climate change. We've been with you in the past weeks where we looked at the effect of climate change on food systems. We moved on to look at the effect of climate change on land, water, and energy. We are building momentum as we attack these complex nexus issues, which don't belong to one faculty, but bring all of us in academia to put our toys together to address the challenges. For today's webinar, we are looking at the nexus that brings people, that's us. It brings our environment and also the things we love the most, our animals. What is the effect of climate change on One Health? I hate it when we say One Health and we don't unpack it. So this morning, I have with me a panel that's going to take us to dreamland, where they will explain, what does One Health mean? How is One Health impacted by climate change, and what mitigation and adaptation strategies do we bring together? But most important, what Africa should be doing? What are the policies that we need to put in place to make sure we stand tall to meet Agenda 2063, which defines the Africa we all want? I'm excited to have an all-Africa panel that's going to help us unpack these issues. I'm going to be your moderator for the first segment and then hand over to my colleague, who is an expert in policy advocacy, Mrs. Sitembile Mwamakamba. But for this brief segment, I'm going to start with two experts who are going to unpack what One Health means. We will then pause and go back to the thematic brief that has been prepared thanks to our sponsoring partners, the French government who've contributed, the Bill and Melinda Gates Foundation, and most important, UNEP, a United Nations Environment Program, who actually say to us, go live, have webinars, look at the webinars on the 4 issues that we are focusing on: food systems, water and energy, One Health, and next week we are going to have our 4th thematic webinar on biodiversity and land. Next month, we're going to jump to another series where we dig deep into our regions. We've been tasked to look at 5 regions: North Africa, East Africa, West Africa, Central Africa, and Southern Africa, where we are really going to bring all practitioners, all the policy actors, and say, if we go to a global convening, what is the message from Africa? Can we for once drive our academia to equip us with the messages that will make Africa a better place? Without further ado, let me introduce my panelists for this first segment. I'm going to be engaging with Prof. Stephanie Salias, who is an expert in her own right. She's a technical advisor to Africa's CDC Division of Surveillance and Disease Intelligence, where she supports the event-based surveillance and One Health programs. She's a world-renowned expert in this area. Prior to this, before she joined CDC Africa in 2019, she worked as a vet epidemiologist in the US CDC's Center for Global Health, where she served as a liaison person with the CDC's One Health office and implementing public health programs, interfacing relate research for diseases like dengue fever, rabies, Ebola, and Zika. But most recently, we're fully privileged to have her at our doorstep, where she is supporting activities around AU member states and coordinating evidence-based surveillance. These are the people we need in the room. They go around Africa, they see it happening, tell us how best do we position. I also have Dr. Linda Dutoit, who is a senior lecturer in the Department of Animal Science at the University of Pretoria. He's based at the Faculty of Natural and Agricultural Sciences, and his main role is just livestock. He looks at production systems, pastures, rangelands, the nutrition of our animals, and small stock nutrition and large stock. He's currently serving as a member of the South African Society for Animal Science and a member of the South African Council for Natural Scientific Professionals. So we've got the animal people here, those who look after the animals we eat and those who make sure they don't transmit diseases to us. After my engagement with the two, I'm going to introduce the speakers who will follow them. Without further ado, let me go to our two-person panel. Our title today, webinar 3, is People, Animal, Ecosystems. What is our health and well-being looking like in the context of those three? The people, the ecosystems, and our animals. Let me start with you, Stephanie. You've been all over Africa. And I did say that One Health sounds easy to pronounce, but we know it's complicated. You have an audience of over 99 registered participants stemming across academia, 54%, so you're comfortable with your colleagues. With NGOs, 11%. We have government, UNHCR, farmers, the youth. They are all here to hear what is One Health and why should we worry about climate change and One Health. Over to you, Stefan.
Thanks so much. So I think two things that come to mind, and I'm sure many of you have heard the quadripartite definitions of One Health, and how we define it at Africa CDC is that One Health is a collaborative, multi-sectoral, transdisciplinary approach to attain optimal health outcomes for people, animals, plants, and their shared environments. But the two words that stick out to me are collaboration and transdisciplinary or multidisciplinary. And the reason why those stick out to me so much is because I know that I would not be sitting here, I could not adequately advise on the work that I do at Africa CDC if I had not specialized and studied as a veterinarian, or I had done the work within the public health field for as many years as I have. And so there really is a need to specialize. We need those smart people in the room that have that nuanced information and that unique perspective to all come together. But that's the trick, right? Is networking all of these brilliant minds. And how do you do that? And that's why the term collaboration, I think, is also a really important piece of that definition, and that really, sticks with the importance of One Health. So, how do you bring all of these folks together to solve these problems that we're all facing? And climate change is a huge one that impacts everyone, right? It impacts us as humans, it impacts the environment, it impacts all of the animals. And we know that with climate change, we're actually seeing as the climate increases in temperature year by year, we're seeing that there are now diseases that were limited to certain regions that are now expanding to other regions. We're seeing increases of spillover from wildlife to humans, right? We've seen with the pandemic, right? That could be potentially driven by climate change, and other pandemics in future could be driven by climate change. So it's a very important topic, and it really requires all of us coming together to solve it. Thanks. Oh,
Thank you very much. Thank you very much for checking. And for me, that's just a snippet. You are coming from the vet side. Should we always use the veterinarian's lens when we talk One Health?
So yeah, no, I think you're right. We need everyone. So it's funny, I guess I'm in a One Health household. I'm also married to a physician. So I do also get his perspective, and we did train at the same time. So I learned a lot from being around him, also working with my colleagues. in the public health service that are nurses, that are doctors. We need ecologists, there's laboratorians, you name it. I mean, all of these folks, we learn so much from each other. And so I think, yeah, my perspective is a unique one, but we need many different people and many different backgrounds.
Yeah. So you speak to us, Stephanie, in terms of many this, transdisciplinary this. Is there a pictorial format that you can draw on a wall? When I close my eyes, what should I see?
Sure. So, I mean, I think you've all seen kind of that Venn diagram, right? Where you've got the
No, we haven't. Just show us.
I don't know if I have the Venn diagram here, but one thing I could maybe show, and I don't know, I think this may be helpful. Hold on a second. So let me bring up the slides for you guys to see if this could be helpful for you all. Hopefully you can see my screen. Okay?
Yes, it's showing. Just put it in.
Yeah, let me go ahead and put this into slideshow.
Excellent.
So, you know, especially with regard to COVID, this was a really unique paper that came out that was looking at some of the spillover events that resulted in the COVID pandemic. And so, I mean, you can really see, right? You've got the wildlife that are, you know, kind of in the background, but then as, you know, land use changes, there's more interactions between humans and livestock and wildlife. There's opportunities for these diseases to then pass over into other reservoirs, domestic animals, and then over into humans. And so I think this is one unique, I think, aspect that you can look at to see how all of this is intertwined and collectively can inform each other. One other piece, and this is going to tie into my intervention that we'll talk about a little bit later. And again, this is so this is kind of a depiction of an epi curve, and I'm sure many of you have seen this paper in the Lancet that came out several years ago. But this really does show the interconnectedness and the opportunities for disease spillover from wildlife into domestic populations and into the human populations. And things like weather events, you know, can change. Climate can change all of this. So, you know, things that you could potentially do is you could have early forecast readiness. Things like Rift Valley fever on the continent, right? A lot of us are monitoring the weather events because that can predict when mosquitoes could emerge that are already infected with the virus that could therefore, you know, infect the wildlife and the livestock and then therefore spill over into the human populations. So this is where we all need to work together and really, you know, establish these surveillance mechanisms early on, especially at the environmental, you know, interface, especially with the wildlife, so that we can get ahead of future things that could impact public health and human health. So I'll stop there.
No, but thank you so much for those visuals, because it's all sounding complex and our role is to unpack it so that a 7-year-old child understands One Health is about the people, their environment, and the animals, both wild and domesticated. And it's all commingled to create the complex world that we need to deal with. Thank you very much, Professor Salwa. Now, we've taken veterinarians, epidemiologists' context to unpack One Health. Can I jump to my world of animal sciences, a world where you want to make sure we have sufficient food, but most important, you want to make sure that that meat, that milk, those eggs are safe and nourishing to the body. Dr. Lindeke Dutoit, can you take us to your world? What does One Health mean from the lens and the entry point of animal sciences?
Thank you, Prof. And thank you for having me. It's a pleasure to speaking to everybody today. Yes, like you said, that as an animal scientist in the tip of Africa, it's our responsibility and our pleasure to actually produce food in a responsible, ethical manner taking sustainability into account. So in my point of view, if I think about One Health, I think about connectivity, and that everything is similar to what Stephanie said, is everything is connected. There's an integral connection between the people as custodians of the animals as utilizers of resources in the land, and providing feed and quality products for human health and development, the plants itself and the environment then where everything is living in. And if you look at animal production as such, the efficiency within a livestock production system is then also dependent on the interactions between the animals, the feed resources that's available to those animals, the environment in which the production system is situated, the infrastructure of the farmers, and then the farmers themselves. And as Stephanie said, I think it's very important to try and connect all these different facets and follow a multidisciplinary approach to try and face these challenges that we're facing, especially in the developing world in terms of food security, the sustainability of our production systems long term, and then providing quality products in terms of nutrition for development of our children and our human health.
Thank you very much, Linde. You are doing a lot of research on this. What would you say is the big question that Africa should be addressing?
Again, yes, African production systems is a little bit different than the production systems in the Northern Hemisphere. And I think we sit on a wealth of indigenous knowledge and opportunities in terms of our indigenous plant species that we haven't really looked at. So it's actually quite exciting to be in this field at the moment in the tip of Africa. Within animal science, there's different facets. We look at animal nutrition, feed resources, and the ruminant environment of cattle and sheep. Then we have a genetics base where we, again, in Africa, we're unique with our indigenous livestock breeds that has been adapted through eons to deal with low quality feed resources, deal with heat. They're very resistant to endemic diseases, and we need to find a way to incorporate this into more, or to incorporate into a more commercial production system. And then looking at feed resources, we are mainly based, especially in sub-Saharan Africa, in extensive production systems. So using rangeland, not intensive, smallholder farmers make a big chunk of what our food production is about. So selecting certain forest species and forest species mixtures that is adapted to Africa, to Southern Africa, that will then provide a high quality diet, but at the same time also reduce the emissions that those animals produce. In other words, we're trying to reduce the emissions intensity of our production systems. And actually, we've been doing this for the last 100 years or so, since we started domesticating animals. We've slowly been improving our production systems, looking at genetics, looking at improved feeding, looking at feed additives that we can include in the feed to try and replace in-feed antibiotics, to try and reduce antimicrobial resistance in our production systems. And in Africa and Southern Africa, we are in a unique position where we do have these indigenous plants that has not been looked at yet. But hopefully we can then start and evaluate them and see if you can find any substance that can reduce emissions, improve production, and improve the quality of the product that we produce.
Excellent. So we have an answer. It's a question I posed. What should we be doing more of? Clearly, we need to smell the roses around our own environment and find a solution that is endogenous and makes us better rather than, looking outside. Let's stay in, let's source out the genetic content that is adapted, but most important, innovate around the resources that we have. Thank you very much. Last question to you, Stephanie. When you look at innovations around the world, around Africa, what would you say is one big innovation that you would like to see us taking to scale when it deals with One Health and in interface with climate change?
Sure. Absolutely. So I think this is where I'm going to be a huge advocate for increasing our early warning response capacity on the continent. There are amazing systems and One Health structures that have been put in place on the continent. And I think that the rest of the world has a lot to learn from some of these systems that have been put in place in many countries. So like Uganda and Kenya and Nigeria, I could go, South Africa, you know, there's many different things that have been put in place. So with regard to early warning, I'm a huge advocate for things like event-based surveillance and taking it even a bit further and making it coordinated. So coordinated across multiple sectors. But for these systems to really be impactful and successful, there needs to be a focus on strengthening the surveillance, the sector-specific surveillance within the environmental sector and especially within the wildlife sector. Because you can't build coordinated surveillance across multiple sectors if there's not surveillance already in place in these sectors that you need to be speaking with. So
excellent.
Yeah, I think that's a big one.
So for me, that's a big one. Every country has some sort of surveillance system. Can we as Africa mop those up, assess them, and make intentional efforts to take to scale what is working?
Absolutely. I mean, there's a number of tools that the tripartite had put together, these operational tools to actually assess the existing surveillance capacity around One Health. And so countries can do something like that. There's a surveillance and information sharing operational tool, for instance, that's now been piloted in Uganda and plans to be piloted in Sierra Leone in the coming months. And this is something that Africa CDC is helping support member states with in collaboration with our tripartite colleagues. But that's one thing to understand where the gaps are. But then there also is a need to standardize data. And there's also a need to put in place data use and data sharing agreements so that when data is produced, it's shared across the different sectors. And there's also a need to support these systems and fund these systems and not have them be standalone projects, but actually be embedded within programs within the ministry. So there's a lot of work that needs to be done.
I love that. I love that, but at least we are calling it out, because at times we are quick to look outside. So we are saying within Africa, what is working? What is it that we can adopt, adapt, and scale? And I love the examples. I hope you will make the submission so that we beef up our policy brief, because policymakers just want the points. What should we do? Who has already been doing it, and how do we take it to scale? And that's what these webinars are all about. Thank you very much to our two experts for unpacking their journey from the animal sciences, from the veterinarian side, and also from a global perspective of what they are seeing is happening. I now want to move deeper into what we have in front of us. I'm sure all of you received a thematic brief that you were supposed to review, share with your colleagues, and give us feedback. So I'm going to invite our next speaker, but I've been told by our IT man that can we all go on camera, because he just wants to celebrate that we've passed the 50% mark of the registered participants. You know how we now all register and not show up? He's excited that we have shown up and he wants to do a screenshot. So please, if you can, put your video on, and we are going to say hello with a big wave to everybody who's joined us online. And thank you. Good to see our speakers who were in the previous webinars. Dr. Mapedza, welcome. Thank you, thank you, thank you. Excellent.
Hello, Prof. Lindy.
Hello, everybody. Thank you so much. Thank you. That's the African wave of goodbye. We can't go on without smiling and greeting each other.
Wow.
So we go off camera and introduce Miss Wezi Chunga Sambo. Miss Chunga Sambo serves as a program officer for the Partnership for Aflatoxin Control in Africa, short name PACA, which is based at the African Union Commission. Wezi coordinates the implementation of regional and country PACA activities in COMESA, East Africa, and SADC regions. And she has contributed to the continental work of the African Union, such as the development of the Africa Food Safety Index, and continues to work on the implementation of this index in AU member states. She also supports the AU in coordinating the Ecological Organic Agriculture Initiative, which is being implemented across member states and regional economic communities. Wezi is a friend. She's a friend of Fanapan, she's a friend of Africa, and we've asked her to deliver this message. She is not the author of the message, but she's just the right messenger because we hope she will take it to the rest of Africa. Over to you, Ms. Wezi Chunga Sambo. Can you deliver the thematic overview on people, animal, ecosystems, health, and well-being? Wezi is muted.
There you go. All right. Good afternoon, everyone. Thank you very much, Prof. Sibanda. Good afternoon or good morning from wherever you are across the globe. I'm going to be presenting to you about the nexus on people, animal ecosystems, and the impact on health and well-being. If you don't mind, I would like to request that I switch off my camera because my internet bandwidth is quite low.
Excellent. No, we focus on the presentation.
Wonderful.
You're fine.
Thank you very much. Okay. So my presentation is going to look at first at the background, the problem. What is the current problem in terms of people, animal ecosystems, and the impact on health and well-being? Then we are going to look at the different frameworks that currently exist, and if there are any shortcomings, and recommend how to address those shortcomings. Then we are going to look at the nexus of people, animals, and well-being, and I'll give an example on aflatoxin control, which is also looking more at the One Health approach that was presented earlier. And then we are going to look at the innovations and solutions that are worthy of investments before discussing the conclusions and recommendations. So in Africa research analysis, the linkages between ecosystem services in general and human well-being remains largely neglected. Although these different areas are explored independently, the linkages is what is really missing. So according to a study done by IPBES, the assessment report, they identify that changes in ecosystem services do not affect all people equally. Often the poor and vulnerable social groups are those mostly hurt by land degradation. Secondly, it says that people live in complex societies, and any impact of ecosystem services on quality of life is mediated through institutions and social structures. And thirdly is that water security is directly linked to human health, food and energy security, yet ecosystems that help maintain freshwater supplies, such as forests and wetlands, continue to be degraded. In terms of governance structures, there are quite a few governance structures that exist. At continental level, at global level, we have the Sustainable Development Goals, in particular Goal 3, which aims to ensure healthy lives and promote the well-being of people of all ages. This goal desires to, amongst others, sustainably reduce the number of deaths and illnesses from hazardous chemicals and air, water, and soil pollution, as well as contamination by 2030. We also have the Convention on Biological Diversity, whereby parties have undertaken to conserve biological diversity, sustainably use its components and air in fair and equitable manner. And then we also have the United Nations Framework Convention on Climate Change, whereby parties have, where feasible, undertaken to take climate change considerations into account in their relevant socio-economic and environmental policies and actions. At the Africa level, the continental Africa level, we also have various frameworks that speak to the area that we are discussing today. These include Agenda 2063. We have the Banjul Charter, and then we've got the Africa Convention on the Conservation of Natural, on Nature and Natural Resources. So let me talk through those at the Africa level. So the Agenda 2063, the Africa we want, calls for or wants all Africans to have healthy and well-nourished citizens and a high living standard, life quality and well-being for all citizens by 2015. There are also other instruments and frameworks such as the Malabo Declaration that goes deeper into 7 different declarations looking at how we can accomplish the Agenda 2063. In terms of the Africa Charter on Human and People's Rights, it focuses more on the people element. And Article 16 and 24 of the ACHPR provides for the right to physical and mental health of individuals, as well as the right to generally satisfactory environment favorable to their development. On the revised Africa Convention on the Conservation of Nature and Natural Resources, otherwise known as the Banjul Charter, it focuses on the animals and ecosystems. On these 2 frameworks, 54 African states have ratified the ACHPR versus the 17 ratifications on the R-ACCNNR. At sub-regional level, there are some policies and instruments. I think more work needs to be done to really tease out what really exists at regional economic community level. But more or less, they neither express nor are they tacit in this regard. So we need to ensure that regs have got very explicit policies and frameworks that are looking at these different areas and that are aligned to the continental frameworks set by the African Union and also aligned to the global frameworks at the United Nations. I'm going to give you now an example on the nexus between people, animals, and well-being. And I'll use aflatoxin control as an example. This is the work that I'm currently doing at the African Union. So just briefly, aflatoxins are a naturally occurring toxic produced by certain fungi, mostly Aspergillus flavus and Aspergillus parasiticus. And they, unfortunately, they occur mostly in the cereals and the staples that Africans consume, such as maize, groundnut, sorghum, etc. And they can occur anywhere along the value chain. So they are said to be one of the most pervasive food safety problems in Africa, whereby they contribute 30% of liver cancer cases in Africa, and 40% of commodities in local African markets exceed the maximum limits in food. And Africa is currently losing about $450 million to $660 million of exports due to aflatoxins. So it is a very big problem. And now it shows a very clear example of how we need to address human, animal, and environmental factors together, because all these interact and the impact on the well-being and health of people. So at the environment level, changes in temperature and water availability related to climate changes contribute to mold growth and production of mycotoxins. So if you follow my diagram, you see that fungal growth of aflatoxins increased due to the environmental factors. And then this in turn increases the levels of aflatoxins in the food that humans consume, as well as in the levels of the animal food that animals consume. When animals consume this food, they also continue on, and the aflatoxin B1 is turned to aflatoxin M1, which can still be passed on to human beings. And very scary, it can be passed on to to children while the mothers are pregnant, as well as to the food that we all eat. So this goes back again to human consumption and impacting our human health. And so it is very important to look at human, animal, and environment and the different interactions they have, not only on aflatoxins, this was just an example, but on all the issues that are interconnected and that need to be coordinated to have a greater impact in terms of our interventions. So a key message is educating stakeholders on the interconnectedness of humans, animals, and the environment is paramount for coordinated efforts in addressing issues really that cut across these sectors. In terms of the innovation solutions and that are worthy of investment, we have identified in the technical briefs that were shared with you 3 areas. The first area is that there is need for greater emphasis on Indigenous knowledge systems. So Indigenous knowledge systems are intricately weaved with the tenets of sustainable development. They provide a culturally sensitive development paradigm, and they have shown concretely how economic and human rights dimensions can be addressed simultaneously. When complemented by other forms of knowledge, Indigenous knowledge systems can contribute to providing a sustainable future for the people of Africa. And it is also important to incorporate them within existing scientific systems, as this can aid socioeconomic development that could yield positive effects on various targets of the SDGs, Agenda 2063, and the other frameworks that we discussed. These are just some examples on the Indigenous knowledge systems, whereby the University of Johannesburg and University of Northwest University have aided in the identification and establishment of communities of practice. And these communities of practice are located within a local community that chooses its own Indigenous knowledge systems to address problems and survive. I think the earlier speakers talked about the importance of knowledge and information systems, because we really need to bring together what exists so that we can co-create solutions as well as share best practices that can be scaled up. And then another example is the establishment.
Wherezy, we lost you.
Establishment of Indigenous knowledge systems documentation centers has done. Can you hear me now?
Perfect. Thank you. Please
okay,
proceed.
Wonderful. Sorry, my internet is a bit funny. All right, the second solution, and I'm nearing the end of my presentation, so hang in there with me, is the establishment of marine protected areas. And this, there's an example in West Africa where we've got marine protected areas that support the growth of maintenance of the protected areas in the region. They also protected areas serve as a key example of measures that are already contributing to the recovery of some threatened species. In West Africa, the rationale for setting up MPAs is for the protection of fish biomass and of certain emblematic species. With the implementation of the national determined contribution in the context of the Paris Agreement on climate change, they further play the role of supplying key services for mitigation and for adaptation. An example is the West Africa Bank d'Arguin National Park, which would contribute 20% of the Mauritania's mitigation objective valued at 9 billion euros, with an annual running cost of only 1 million euros. So you can see that the investment outweighs the value that the country and the continent is able to get from this investment. And then the measures put in place for the perspectives of biodiversity are now benefiting the society far beyond the initial mandate, with a very high return on public investment. So this is a great example that can be scaled out in other parts of Africa and across the globe. The third solution is development of edible insect recipes as an alternative sources of protein for human food and livestock feed. Now, this is thinking outside the box, because we all know that the effects of climate change will result in underperforming agricultural systems. Yet there is increased demand for protein from conventional agriculture. Yet edible insects as alternative sources of protein for human and livestock feed would provide the answer that we are looking for. And these are interesting facts that I would like to point out, is that farming insects has a low carbon footprint compared to conventional crop and livestock production. They are consumed traditionally as good sources of nutrients for humans and livestock. Consumption has been diminishing, unfortunately, mostly due to teenagers not really being part of this fad. And we need to raise awareness of the importance of really keeping these indigenous traditions and practices and passing it on to the next generation, so that they can continue its use, especially when it has got lesser impact on the environment. There's also lack of sufficient quantities has hampered the large scale use of insects as livestock feed. So there's need to encourage more production of insects. So we recommend and encourage more African countries to produce insects at large scales to minimize greenhouse gases emission associated with crop and animal production at large scale, and put in place policies for collection of wild resources. And finally, in terms of conclusions and recommendations, we recommend that we increase the pace of ratification of key African legal instruments. I pointed out the various charters, the Banjul Charter, the ACHPR, that most African countries need to ratify and submit their ratification to the African Union. So this needs to be fast-tracked if we are going to be able to address the different policy issues at a continental level. There's also a need for increased research outputs on the linkages between ecosystem services and human well-being, which may better aid policymakers in understanding the nature of the issues faced in this regard, as well as the nature of the interventions required. We also recommend that there is need for a greater emphasis on indigenous knowledge systems, as they inherently advance sustainable approaches that are beneficial to human health and well-being. We encourage the establishment of MPAs for the protection of marine biodiversity, and explore how they may integrate alternative sources of protein. We also recommend that we explore how we may integrate alternative sources of protein, such as insects, in human and animal diets to mitigate the impacts of climate change on agricultural systems. Lastly, we recommend that there is need for educating stakeholders on the interconnectedness of humans, animals, and the environment, and encourage better coordination among sectors. With that, I would like to thank you for your attention. Thank you, Prof. Sibanda, over to you.
Thank you very much, Wezi. We couldn't have found a better messenger for that message. You've been able to unpack an intricate subject and also show us, in terms of the African context, what are the different treaties that are in place, where should we be reporting progress, but also picked out where we are not doing anything. We've always eaten insects as Africa, but all of a sudden we're being formally told, eat more, research into them, and grow more. Thank you very much. I'm not going to preempt your presentation, but let me go to an expert who is going to respond and also showcase the blind spots of what we are doing less of and should be doing more. Allow me, colleagues, to introduce Professor Wanda Makota, who is my colleague. She's the director of the Center for Viral Zoonosis at the Faculty of Health Sciences at the University of Pretoria. She also occupies 2 research chairs. One, the DSI NRF South Africa Research Chair on Infectious Diseases of Animals, which we call zoonosis. And she's also the chair in People, Health and Places at Future Africa Institute at the University of Pretoria. Exactly where I'm sitting right now, that's where Professor Wanda Makota is sitting. It's an interdisciplinary, transdisciplinary center that was set up, as the name says, to look at Africa and help create the future we want. And she's leading on issues of people, health, and places. She's also big at the global stage, where in 2021, she was appointed as the co-chair of the One Health high-level expert panel advising the WHO, OIE, FAO, and UNEP on issues of One Health. So we couldn't have gotten a better expert to review our thematic brief and advise us on how best we can position advisory policy messages for Africa. Over to you, my colleague Vanda.
Hey, thank you, Lindiwe. And I must say, listening to the previous speakers, I actually feel that they can contribute much more to this topic than I can. But I'm going to try and just highlight a few things. And I need to come back to One Health. It was also mentioned by the first speaker, Dr. Stephanie. And if we look at the One Health definition and just highlighting a few positive things that's happening in the global environment, we finally have a definition that has been communicated by all four partners that was just mentioned by Lindiwe, that we now call the quadripartite, where UNEP is an equal partner in this group of UN partners that includes the WHO, OIE, and FAO, and then UNEP. And this One Health definition is a bit broader than some of the previous definitions. It's got collaboration and multi-sectoral collaboration in there, but it really says that that the health of people, animals, and the ecosystem has to be optimized, and there must be a sustainable balance. But if you look further at this definition, and that's where I want to link it today, it's really bringing all the sectors together to tackle health threats and ecosystems while addressing the collective need for clean water, energy, air, safe and nutritious food, and taking action on climate change and contributing to sustainable development. And I think one of the challenges we're still facing is that people are not really linking infectious diseases to some of these other things. We talk about it, but the linkages is not so clear, and it's not practically on the ground. We don't see that we're really implementing these linkages. A few things that's important for Africa, if we look at the One Health definition, is really equity in sectors and disciplines, but also socio-political and multicultural parity. This is some of the underlying principles of the One Health definition that was released by the One Health high-level expert panel. And coming back to what some of the previous speakers also said, there needs to be an inclusion and engagement of communities. So it's not just including them, it's really engaging with them on all these aspects, and also marginalized voices. There needs to be socio-ecological equilibrium, and there needs to be stewardship, where we as humans need to take responsibility to change behavior, to really start changing some of these issues in the long term. And then it comes back to transdisciplinarity and multi-sectoral collaboration with all disciplines. But also one of the things that's part of our definition, part of the underlying principles, is it must include modern and traditional forms of knowledge and a broad representative of perspectives. And that came through in all the talks today, which I think is something that we can really contribute if we do projects and research in Africa. Even if we start looking at writing policy and other documents, we really need to think about some of these principles. Yes, there's barriers. There's still lots of barriers, and there's still lots of reasons why we can say it's not so easy to do One Health and try and look at ecosystem, animal, and human health collectively. And some of the things that's still an issue is the way that formal structures are structured. You know, we work in certain ministries, very difficult to work across. The funding is in certain silos. And we really need to look at how we can break that down. And sometimes that requires some policy and other changes that we need to look at. One of the things I said right at the beginning is that we really need to look at communicating how important it is to look at these things collectively and how it's linked to infectious diseases, climate, water. All of these things are in the end linked to each other. And also looking at a workforce that we can develop that can address all these issues collectively. And if I just listened to some of the talks today, I made a few notes, and coming back to Stephanie's talk on surveillance is actually a really important point. So it's one of the things we're looking at in terms of OLAP is what is One Health surveillance? It's not just testing animal and human samples. It's really trying to collectively also look at the drivers of disease emergence. And this is where some of the ecological and environmental and human behavior factors is becoming really important. So we say that, but it's not so easy to integrate all of this. And we really need to look at processes where we can do this and we can bring data from sectors together. So it comes back to one of the things I think it was in your concept note on data. You know, how are we going to share data efficiently going forward? And I think that's one of the things that's important to address. Food systems, food security, how we get our food is really important in the African context. I think these things are very unique to certain geographical areas of the world, and we need to understand it really at ground level. It's not the same risks in terms of infectious diseases, for instance, everywhere. We need to really understand what's happening on the ground and go into communities and use the knowledge of people in communities. And then I really like Wesley's talk where she said at the beginning that, yes, we do work on biodiversity, on ecosystems, on a lot of these things, but we're not really linking it. And we really need to ask ourselves if there's not a way to link all these things in the work that we're doing, and that we need frameworks and policies to address this. There's some, but they're not efficient for everything, and we really need to look at that. And then really looking at Indigenous knowledge. And I really like the specific examples that she actually used, where we could see how you can link some of these issues in one project. So I hope I don't speak too much, Lindiwe, but I'll stop there. Thank you.
Thank you very much to Professor Wanda Makota. You've taken a 360 look at the thematic brief that was presented, but more important, brought in knowledge from outside in terms of the critical issues that you see as needing more investment, but also a spotlight. I particularly like the uniqueness of our Indigenous knowledge, but also the issue of data and how we communicate that, because that's what we will take to our policymakers. That's what will strengthen the research to policy interface. But most important, that's where our private sector will find space for scaling up technologies that will make Africa a better place. Colleagues, we are deep into the conversation of the impact of climate change on our people, our health, our ecosystems. It's about health for all, health for us, health of our livestock, our animals, and health of our environment. We have unpacked the issues. I now want to hand over to my colleague, Mrs. Sitembile Mwamakamba, who is going to take us to the next segment, the people segment. I'm done with the researchers. They've told us what they're seized with in terms of finding questions and solutions to address societal problems. They've told us about transdisciplinarity, how it all comes together. But let's go to real people who are affected by these problems. Let's also go to you. I see you've been posting questions on the chat. I want to encourage our previous speakers who are in the room to also reflect on the subjects that we dealt with. Climate change on food systems, climate change on land, water and energy, and today, climate change and One Health. Can we start putting the puzzle pieces together on the positioning we want? Over to you, to Mrs. Tembile Mwamakamba.
Thank you, Prof. Wanda, and a good afternoon to everyone. My task is really simple. It has been to field the questions and the contributions that have been coming through the chat, and to then now facilitate a discussion. We will ask that if you want to make an intervention, to please raise your hand so that I can see you and I can pick on you. I think we've already received a couple of interesting questions that I will read loud here and request Dr. Celia and Dr. Dutoy to be on standby to respond to this question. The first question came from Mahlatse Makola, and the question is, would you say the environment interface is where direct impact is felt, and which stakeholders would this normally include in terms of production systems? So that was the first question that came through. The second question came from Simba Swanda, and the intervention was, there's a common practice where food that may not be good enough for humans is given to animals, after which humans would then consume animal products from animal feed on contaminated food, e.g. food high on aflatoxin. How do we break the cycle? So those are the first three questions that I would want to just bring to the table here and ask Dr. Celia and Dr. Dutoit to be on standby to respond to those two questions. I saw Simba, your hand was up, but it's gone now. My assumption is that you wanted to bring that question that you asked in the chat. Let me maybe start with Dr. Celia to respond to those first three questions.
Sure. So I think with regard to, maybe I'll start with the food question. So with regard to, I think food stuff that's being given to animals. So specifically, I think they were referring to aflatoxin. Is that right?
Yes, I think the question did mention aflatoxin.
Yeah, so I think it's an interesting component, because I know that anything that we feed to animals, right, and especially with things like aflatoxin, so if we're feeding contaminated feed to animals, they can actually contain aflatoxins in their milk and the other products that they produce. So there should also be regulations in place on the feeding of quality foods to animals to ensure that if we are consuming those animals, you know, that we are not getting contaminated with those materials as well. Also, aflatoxin can also impact the health of animals as well. So those are things to maybe keep in mind. I don't know if I clearly answered that one. Let me know if there's any follow-on I can do for that question.
Okay, I think we will see from the chat. I'll just keep monitoring.
Okay.
Do you want to take the other first two questions, or should I just move on to Dr. Dutoit?
I think the first one was more ag related, maybe. So I don't know if we wanted to pass, but I'm happy to come to those so we can. Yeah.
Okay, let me pass it on to Dr. Dutoit. Dr. Dutoit, the question is, would you say the environment interface is where direct impact is felt, and which stakeholders would this normally include in terms of production systems?
Yes, I think with the pressure coming from consumers at the moment globally, everybody's concerned about the environment, and it actually touches everybody. So I think that's a very important interface for all stakeholders. And in terms of production system, the stakeholders that we need to get involved, obviously, is the governments, the financial institutions as well, because we do have interventions and strategies to reduce the environmental impact of production systems. But the producers don't always have the financial capability to incorporate these scenarios or strategies into their production systems. So we need to get government involved. We need to get the financial institutions involved, and we need to get the consumers involved to get the right information to them. And the bottom line is, yes, animal agriculture is one of the industries that is really impacted by climate change and the effect of all these other factors in terms of droughts and high rainfalls and all that type of stuff. But animal agriculture also sits with a unique hat on in terms of a solution to improve the effect of a changing climate in the short term through reducing methane emissions. I see there that one of the attendees, Rolf, spoke about regenerative agriculture and the effects that animals have on the environment, in improving the environment, improving soil carbon, water holding capacity, and all that type of stuff. Yeah, so I don't know if that answered the question.
Yes, yes, I think that does,
okay.
Answer the question.
Linking to the third question, sorry, Thembi, is in terms of the aflatoxins, they are actually in South Africa, I know definitely, but I think in all the other countries, there are strict regulations in terms of mycotoxin contamination of raw materials. So before an animal feed company will take in a raw material load from a farmer producer, they do analyze for mycotoxins. And if it's detected, that whole load of maize or whatever raw material it is will get rejected and will not go into the animal, the commercial animal industry. I think the problem lies with the producers then need to get rid of that raw materials, and they then sell that off to smaller farmers on the side, and that's where we need regulations to come in more stronger.
Yeah. Thank you for that intervention. I think I've just also noted, the issue of financial institutions coming big to address some of the challenges that farmers perhaps face in as far as financing the innovations and the technologies that they're supposed to uptake. I think that's a very important point, and also the need for stricter regulation when it comes to how do, say, big farmers dispose some of the contaminated food, making sure that it doesn't end in the hands of the smallholder farmers. Thank you for that intervention. I see Simba Spander's hand is up. Simba, you have the floor.
Yes, thank you, Thembi. I've got a couple of sort of comments to make and also some observations. One is that we know from studies, several studies, that climate change actually has an impact on the nutrient content of, crops. So you would imagine that if humans are going to eat those crops, for instance, there are studies that have shown that as CO2 concentrations increase, you get reduced some key nutrients actually go down within the products that are produced. So that's a direct impact of climate change on the crops that both humans and livestock would consume. So obviously we can track what the impact is going to be there. But I've also commented in the chat that I think if you go back a couple of weeks when we heard from one of the keynote speakers that there were 3 things that we needed to focus on. And one of those things was our consumption patterns. And I think that is still very key in this webinar, that our consumption patterns is, consumers as humans are putting a lot of pressure on the environment to the extent that we continue to respond to this increased demand for animal, products. But obviously, this basically puts a lot of pressure on the environment. The production systems get too concentrated, and within those kind of systems, there's a greater chance of getting, diseases moving from animals to humans. And also, it's causing us to eat some novel things like bushmeat, which we would not normally eat. And we know how COVID, at least if you accept the origins from Wuhan, that this was consumption of what we would consider in this part of the world as, bushmeat or whatever. So obviously this pressure is something that we need to look at. How do we look at different patterns or different sources of food to meet our nutrient needs as humans, put less pressure on the environment, and produce animal products in a more sort of humane and aesthetic way without having chickens, for instance, in batteries and all sorts of other things that we've had to do with industrial, livestock production. So that's an issue that I think we need to think about, and our governments as well. The other point, we've been talking about aflatoxin. I remember one time we had an experience where one government in Africa, which I won't mention, were not happy that a study had identified high aflatoxin levels in milk, and that would have actually caused a serious food security issue, because what it would mean is that they would have had to condemn a lot of the cereals where these animals were fed from, which would also mean that governments would need to consider compensating farmers, especially smallholder farmers. So there's some serious political and food security issues involved here. It's not just about making regulations, it's also about governments sort of saying, look, yeah, if we this year produce so much tonnage of maize and we find that a large proportion of that maize is contaminated with aflatoxin, as a government, what would you do? Would you actually go and condemn this maize and therefore destroy it? Remember, we said it should not be fed to livestock, and at the same time create a food security crisis. So these are the kind of questions that governments have to grapple with. You'd think that is a straightforward question morally, just condemn the maize, but it's not as simple as that. So maybe some expert opinions on these points. Thank you, Thembi.
Thank you, Simba, for those points that you have raised. I've just been furiously writing some of the points that I believe we still need to take forward in this discussion. I think it's interesting that you brought the point of producing animals in a more humane way and also making sure that ultimately it doesn't affect human health. Elma Amatefe on the chat has just shared some news that the ban on antibiotics in livestock took full effect in January this year, which is a good thing. Now we want to see some movement in Africa. So thank you again, Prof. Simba Sibanda, for that intervention. Also, one of the things that you spoke about is the consumption patterns that we are seeing changes in. Our consumption patterns of animal products is really putting immense pressure on the environment. So how do we sort of produce animals for food security purposes, but at the same time put less pressure on the environment? I think those are very important points. And I see Dr. Stephanie Selya's hand is up. May I give you the floor?
Sure, thank you so much. I really wanted to touch on Professor Simba's point around reporting of incidences and kind of what do you what's the contingency plan? What do you do? The international health regulations were put in place to really they're put in place to ensure health security for the globe, and it calls for immediate reporting of certain kinds of events. And I know that OIE does have in place something very similar for animal health events as well. But I completely understand some of the issues and the sensitivities. And this is what makes data sharing and information across sectors also really tricky, because some of the diseases that are reported could have implications on trade and travel, on food sources and things like that. And so there's reluctance to share some of this information within a country and also beyond borders. And I think that, you can see some of that reluctance, especially with regard to COVID, when the Omicron variant of control or variant of concern was reported from the southern region, and the global population reacted with putting all these bans in place. But I think at least within the continent, thinking, what can happen on the continent to ensure that there's transparency and there's standardization, and there's all of these things so that we are held responsible, that there's contingency plans, there's contingency funds that are put in place on a routine basis so that if things happen, that you can, remunerate the farmers and the livestock workers for, food stuff or that can't be utilized, right? So I think that there still needs to be a lot of systems and policies that are put in place to kind of protect livelihoods as well. And that's definitely a place that needs to be invested in, because there's still going to be that reluctance. If farmers are not going to potentially get any funding back for reporting that they've lost livestock or poultry from outbreaks, there's going to be a reluctance to report those outbreaks, and that could then further exacerbate. So we do need to look ahead of even those systems and see how do we protect lives and livelihoods earlier on to allow for transparency and early reporting. Over.
Thank you, Dr. Celia, for that intervention. I think your point on making sure that we have policies and regulation in place is something that definitely some of the participants are thinking of and has come through quite strongly in the chat. One thing that Elma asked, though, is that whilst we have the evidence, right, to inform the policy, there seems to be a lag in policy implementation due to many factors such as economic and political. Prof. Simbaswanda did mention the political beats, right, and around food security. So how do we get our governments to take tangible action in this direction? I'll just pose that question and would welcome anyone who wants to take a step at responding to that. But first, let me go to Rolf, who has his hand up. Ralph, over to you.
Hi, sorry, I missed a little bit of your thing. The network in Zambia is pretty bad. Yeah, lots of good information. Thank you. I just wondered if we've considered management enough, because I'm hearing a lot of response type of recommendations reacting to problems. We've taken up Alan Savory's holistic management here, and we've put about 30 groups of, or helped 30 groups of communities to get the animals in one herd and start planning their grazing and following that natural high impact long rest, which gives your grass, your vegetation a better chance to recover, and also starts breaking the disease cycles. And in our best model, where I have my cattle with 57 others in a very marginal part of the Zambezi Valley, very, very dry area, not an area you'd normally keep cattle. There's tsetse fly and everything else, but we're seeing massive regeneration of the habitat. Even our streams are beginning to flow better. We have less and less problems finding water for the cattle. The productivity has gone up. We buy cattle, we buy obviously adapted cattle from the area, and immediately they get into a herd, their dynamics change and they start improving condition, and productivity has really gone through the roof. We've really broken the disease cycles. We've not dipped, I wrote it on the chat there, we haven't had to dip more than once or twice a year for the last 4 years, and we haven't done deworming for at least 5 years. We are breaking all these problems down because of change in management, and that means we're reducing cost, we're reducing stress, and we're improving profits. So if we can, and this is all based on traditional management logic. I mean, 100 years ago, there was no dips. That's what people did. They migrated with the wildlife. They broke disease cycles. Can we have a look at this area? Because we are having tremendous success here. And, I can just, it sounds very dismal, trying to solve all the problems that are appearing. But if we start managing different, we may not have those problems. Thank you.
Thank you, Rolf, for that intervention. I think it's definitely one of the examples that we probably need to be capturing in the thematic brief. And I hope you'll have a chance to have a look at the thematic brief and suggest that example as one that goes together with the policy recommendations. At this point, I'm not seeing any more hands, but I would like to then maybe come back to the panelists and the speakers of today to invite them for just final words of any final messages they would like to share with the participants before I hand over to Professor Spanda. Let me maybe take it from, we'll start with Prof. Makota, and then we'll have Dr. Dutoit, and then we'll end, maybe I'll give Wezi, and then we'll end with Dr. Seleya. Over to you, Prof. Makota.
Hey, thank you. Yeah, I want to come back to, I think, what was his name now? Simba mentioned the bushmeat story, and it's extremely important that if we want to change policy and we really want to change how we look at people-animal ecosystems, that we have science-based advice. And we think sometimes we do, but if we really go into the literature, and bushmeat is a good example of that and how it's linked to zoonotic transmission, we realize that we actually have very few good examples backed up by science. And I think that's important for a lot of these issues. We really need to make sure that the science is solid, that we have very good science behind everything that we want to propose or that we want to advise on, but also the mitigation actions. It doesn't just stop with what you tell people not to do. It's also about how that is going to affect people's livelihoods and maybe the broader environment. Because if we do have mitigation actions for certain ecosystem, animal, human health issues, there's also going to be some things that may not be as beneficial if we implement them. And I think that's one of my important messages.
Thank you for those key messages. Let me go to Dr. Dutoit.
Yes, thank you, Timmy. Yeah, just linking with what Rolf said in terms of holistic management. I think it's very important to look at these, not to try and reinvent the wheel, and look at traditional systems that has worked over eons and hundreds of years. But we need to keep in mind that solutions will vary according to production systems and regions, and we need to try and develop regional specific solutions for our animal production systems. We need to continually work at it and monitor it and see, as Prof. Makota now said, see what is the influence of specific interventions in terms of mitigation, not only on the production system, but on the quality of the product. If we develop an intervention that will reduce emissions, but it will also reduce production, the chance of that intervention being adopted is actually negative. So we need to continuously monitor, continuously measure, and I really like Dr. Makota's comment on science-based information, and I think that's the way forward.
Thank you, Dr. Dutoit. Let me come to Wezi.
Thank you so much, Thembile. And I think this was a very interesting webinar because you can see that there's so much that is already being done and so many solutions that we can possibly scale up. I think though that there's still need for us to see
Hi, Wezi, we've lost you.
These different aspects are working together and how they are connected. That we have. Thembile, can you hear me?
Yes, we
Hello?
can hear you now. We can hear you now.
Okay, thank you so much. All right, I was just saying that from the presentations and different speakers, I was just learning that there's so much that is currently being done. And there is still need though, however, for us to look at the way people, animal and ecosystems are linked together and how we can work together to coordinate those interlinkages and how one factor impacts the other so that we have a better coordinated approach that is built on partnerships that will have a greater impact on human health and well-being. And just to also emphasize on Prof. Dutoit's point on domestication, it's really important that whichever solutions that we want to implement or scale up, we need to ensure that it is domesticated according to the country-specific or region-specific issues, so that, again, impact is felt and it is more meaningful according to the situation that is on the ground. Thank you.
Thank you, Wezi. And finally, let me come to Dr. Celia.
Thanks so much, everyone. So I think to build on Wezi and bringing back One Health and the multi-sectoral approach to all of this, there is kind of this, ideal system that we think about and trying to put all of these pieces together. But I also want to just, impress upon everyone that even informal communication, is something that can be established. So really building upon the coordination and just collaboration across sectors and just having those conversations and even sharing information, even if it can be done informally ahead of time, before systems are built and before all of these processes are put in place, can still impact overall health of humans, animals, and the environment. So I think that's one thing that it can be a daunting task when you look across these systems and trying to establish all of this robust One Health capacity. But don't forget that this can be done at any level. So that's one thing to keep in mind, is to start somewhere. So thank you guys, and over to you.
You're muted, Tembi.
Thank you. My apologies. I was going to say, there you have it from our panelists and from the participants in the chat. The science has to be solid, and that it just doesn't stop with what you tell people, but it's also about how it impacts the livelihoods of people. Let's not reinvent the wheel. The solutions will have to vary according to different regions. So let's have region-specific solutions. And let's focus on the interlinkages between people, animals, and the ecosystem. Thank you very much for the very interesting discussion that we have had this afternoon. Let's please review the draft thematic brief that was shared and contribute a lot of rich information to strengthen the brief. Over to you, Prof. Spanda.
Thank you very much, Mrs. Mawakamba, and thank you to our panelists and our guest presenter, Wezi. We've come to the end of our session for today. As I said, this is the third of a series of 4 webinars. Next week, on the 30th of May, we are hosting our final webinar where we are focusing on land and biodiversity. And there we are going to be looking at issues of land restoration. We've just celebrated Biodiversity Day. We want to mop up all those celebrations and put them into an advisory note for our policymakers. So join us at the same time as we have our webinars, 3 p.m. SAST time, in whatever time zone you are in. After this series of 4, we are then going to change gear and go regional. The first in our series of regional webinars will be in West Africa, where we are going to bring the whole community of CLAB members, climate, land, agriculture, and biodiversity, to package the final messages that we are taking to the policymakers. It's going to be an intense week. 6th, we start with West Africa. 7th, we are in East Africa. 8th, we are in North Africa. 9th, we are in Central Africa. And then finally, we round up with Southern Africa to close the series of webinars. Thank you for all our speakers who've spent time researching and sharing their knowledge. And thanks to you in the audience who've actively participated. We can all put our cameras on and do an African goodbye until we meet next time. So cameras on. For those who are able to put your cameras on, this is the time. Thank you, everybody.
Thank you.
Thank you. We shall overcome, and thank you for your time and knowledge.
Thanks, everyone.
Thank you. IT, are you happy? We always want to give back 5 minutes. It's 25 past the hour from my end. Are we good to go?
Yes, Prof. We are good to go.
Thank you, and goodbye.